Hello and welcome to our channel. In this video we will discuss about what is cyanide poisoning, and the basic topics that we will cover in this video are what is cyanide, and next how one can manufacture cyanide, or simply you can say what is the manufacturing process for cyanide. The next we'll talk about the different types of cyanide, and next what are the causes of cyanide poisoning and who is at the risk of that. Next we'll discuss about how is cyanide poisoning diagnosed, that is what the if you have any doubt that you are suffering from cyanide poisoning. Next what are the clinical features, that is what are the signs and symptoms of cyanide poisoning, and at last we'll discuss about the very important topic of this video, that is management. So how you can manage cyanide poisoning if you are suffering from it. What are the preventive measures that you can opt? So these are some basic topics that we will cover in this video. First of all, we'll talk about what is cyanide. So as we all know that cyanide is a chemical compound that contains the group C triple bond N, and this group known as the cyano group, and it consists of a carbon atom and triple bonded nitrogen atom, and it exists in two forms, that is inorganic cyanides and organic cyanides. First of all, we'll talk about inorganic cyanides, then we'll talk about the organic cyanides. So in inorganic cyanides, the cyanide group is present at the anion, and salt such as sodium cyanide and the potassium cyanide are the highly toxic. Hydrocyanic acid, also known as the hydrogen cyanide or HCN, is highly volatile liquid that is produced on a large scale industrially. It is obtained by acidification of the cyanide salts. So this was all about some inorganic cyanides. Now next we'll talk about the organic. So organic cyanides are usually called nitriles. So in nitriles, the CN group is linked by a covalent bond to carbon. For example, in acetonitrile, the cyanide group is bonded by methyl. Because they do not release cyanide ions, and nitriles are generally far less toxic than cyanide salts. And some nitriles, which occurs naturally as cyanohydranes, release hydrogen cyanide. So this was all about organic cyanides and inorganic cyanides. Now next we'll discuss about the manufacturing process of cyanide. So let's talk about it, how to manufacture cyanide. So the principal process used for the manufacture of cyanides is Andrussow process, in which what happened, as you can see here, the reaction I have provided you at the screen. So what happened, in which gaseous hydrogen cyanide is ammonia in the presence of oxygen and a platinum catalyst. The next, sodium cyanide is produced by treating hydrogen cyanide with sodium hydroxide. So this is the basic reaction you can see here on the screen, which is used basically for the manufacture of cyanides. Next we'll discuss about the different types of cyanide poisoning. So basically there are two types of cyanide poisoning. One is acute cyanide poisoning and the second one is chronic cyanide poisoning. Now one by one we'll talk about them. So first of all, let's talk about what is acute cyanide poisoning. So acute cyanide poisoning is relatively rare, and the majority of the cases are unintentional. When it does occurs, symptoms are sudden and severe. So you may experience difficulty breathing, that is dyspnea, second seizures, next loss of consciousness, and the next one is cardiac arrest. So if you suspect that you or your loved one is experiencing acute cyanide poisoning, so seek immediate emergency medical attention, and this condition is life-threatening. So this was all about the first type of cyanide poisoning, that is acute cyanide poisoning. Now next we'll talk about the second type of cyanide poisoning, that is chronic cyanide poisoning. So chronic cyanide poisoning can occur if you are exposed to 20 to 40 parts per million of hydrogen cyanide gas over a substantial period of time. And the symptoms are often gradual and increase in severity as time goes. And the early symptoms may include: first, headache, next drowsiness, next nausea, next vomiting, next vertigo, and next one is bright red flush. And some additional symptoms are also there that may include dilated pupils, clammy skin, slower, shallower breath, weaker, more rapid pulse, and convulsions. So if the condition remains undiagnosed and untreated, it can lead to slow, irregular heart rate, reduced body temperature, blue lips, face and extremities, coma, and finally death. This was all about the two different types of cyanide poisoning. Now next we'll discuss about the causes. That is, what are the basic etiologies that leads to cyanide poisoning and who are at the risk of this cyanide poisoning. So let's talk about it. So cyanide poisoning is, when it does occur, it is typically the result of smoke inhalation or accidental poisoning when working with or around cyanides. So you may be at the risk of accidental exposure if you work in certain fields. Many inorganic cyanide salts are used in the following industries. First, metallurgy, second, plastic manufacturing, third, fumigation, next is photography. And chemists may also be at the risk, as potassium and the sodium cyanides are common agents which are used in laboratories. You may also be at the risk for cyanide poisoning if you use excessive amounts of nail polish remover containing organic cyanides compounds such as acetonitrile, or you can say methyl cyanide. Next, if you ingest excessive amount of certain plant-based foods such as apricot kernels, cherry rocks, and peach pits. Now next we'll discuss about what are the clinical features of cyanide poisoning, that is, what are the signs and symptoms of cyanide poisoning. So let's talk about them. So symptoms of toxic cyanide exposure may appear within a few seconds to several minutes after exposure, and you may experience first overall weakness, nausea, confusion, headache, difficulty breathing, seizures, loss of consciousness, cardiac arrest also. However, severely you are affected by cyanide poisoning depends upon the dose, the type of cyanide, and how long you were exposed. So these are some signs and symptoms of cyanide poisoning that you can observe if you have any doubt that you are suffering from cyanide poisoning. Now next we'll talk about the investigations, what are the tests that you can perform in order to diagnose whether you are suffering from cyanide poisoning or not. So let's talk about the investigation now. So if you are experiencing symptoms of acute cyanide poisoning, seek immediate emergency medical attention. And if you are experiencing symptoms of chronic cyanide poisoning, so see your doctor right away. After discussing your symptoms, your doctor will perform a physical examination. They will also conduct first test is methemoglobin level. So methemoglobin is measured when there is a concern for smoke inhalation injury. Second, blood carbon monoxide concentration, that is carboxyhemoglobin level. So your blood carbon monoxide concentration can indicate how much smoke inhalation has occurred. Thirdly, plasma or blood lactate level. That is, cyanide blood concentrations usually are not available in time to help diagnose and treat acute cyanide poisoning, but they can offer about the blood test that you can perform if you have any doubt that you are suffering from cyanide poisoning or not. Very important part, that is management. How you can manage, how you can prevent cyanide poisoning if you are suffering from it. What are the ways, what are the measures that you can try? So let's talk about it. So there are ways to reduce your risk for the cyanide exposure. So you can first take proper precautions against a home fire. So for that, install and maintain smoke detectors, avoid using space heaters and halogen lamps, and avoid smoking in the bed. Second, child-proof your home. If you have young children, child-proofing your home is essential, especially if you are at a risk of occupational exposures. Keep containers holding toxic chemicals secure and the cabinets that are kept in. Follow work safety regulations. So if you work with cyanides, use removable absorbent papers to line work surfaces. Keep quantities and container size in the work areas as small as possible. You should also make sure that you leave all chemicals in the lab or the factory. Don't bring home potentially contaminated clothing or the work gears. So these are some preventive measures that you can try. Today, see you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. And yes, press the bell icon for more updates. Stay safe and stay healthy. And yes, thanks for watching our video.